The question is going to be, what's the difference between Botox and fillers? We often hear from patients, notwithstanding all of the information that one can read in women's magazines today, what's the difference between Botox and fillers? And I find it surprising that so many people really don't understand that difference, and it can be a little bit confusing. So let's clear it up for you. Botox, which is a trade name for botulinum toxin, is the most popular product being used today, but there are others on the market as well. Now, how does Botox really work? Many people think it's a poison, as it were. Well, indeed, if you got about 3,000 times, that's 3,000 times as much as we use in the face, yes, you could have some serious medical problems. But most of the time, of course, we're using a smaller amount. And Botox works to modulate or change the function of the muscle. And in doing so, indeed, it weakens the muscle a little bit. Now, when we inject Botox to weaken a muscle, what it does is it allows the wrinkles that are above that muscle to flatten out a little bit. But we've also found that we can use Botox to change the position of certain features of the face. So, for example, the Botox can weaken the muscle that pulls the eyebrow down, and the opposing muscle will actually help to raise the eyebrow a little bit. And so Botox works to decrease the dynamic action of the facial muscles and improve the facial features as we would wish. Now, fillers, on the other hand, are quite different. The commonest ones are the hyaluronic acid fillers, and there's many of them on the market. You may have heard of Juvederm and Restylane as being a couple of the more common ones. Now, these fillers are made of materials that are naturally native to your own body, and that's why you don't even get any kind of risk of allergic reaction to them. But they are just that. They are fillers. They just fill up a furrow, or they can add volume to the face. And something we've come to learn over the last years is that the volume loss that occurs in the face is one of the major signs of aging, just like we lose volume in other parts of the body as well. And so the fillers just work to augment those furrows, or to augment the cheeks, or sometimes the lips, as long as it's not too much, to recreate some of that youthfulness that you've lost due to loss of tissue. And so very often we utilize the Botox and the fillers together to give you the very best result, because the fillers will last a little bit longer when they're used along with the Botox. So come to speak to us, and we will describe for you very clearly where Botox will work best for you and where fillers will work best for you, or sometimes we'll use both together. In either case, you can usually get an exceptionally good result.